Hello, my name is Juliana Principe, and today I will be briefing you on a critical health policy issue, ending disability discrimination in organ transplantation. Specifically, I will be discussing the Charlotte-Woodward Organ Transplant Discrimination Prevention Act, otherwise known as Senate Bill 1782. So a little introduction into the problem. People with disabilities often face barriers when being considered for organ transplants. These barriers aren't medical, they're discriminatory. Today we will look at some studies that discuss the reason for not approving patients with disabilities for transplants and how that is due to the belief that they will have poor post-transplant outcomes because they can't take care of themselves. There is also a belief that they do not deserve organ transplants because they have poor quality of life and have a shorter lifespan. Patients are sometimes denied access to evaluation or removed from waiting lists simply because of their disability. This raises serious ethical, social, and medical concerns, which we will also discuss. The purpose of this presentation is to advocate for the passage of Senate Bill 1782, which would eliminate this form of discrimination. The Charlotte-Woodward Organ Transplant Discrimination Prevention Act was introduced in May of 2025 by Senator Ashley Moody of Florida. The bill was inspired by Charlotte Woodward, a woman who was diagnosed with Down syndrome and needed a heart transplant but was denied. After a long fight, she eventually received the transplant and is now an advocate for this cause. The bipartisan bill is currently in committee and has been passed in the House but not yet passed in Senate. Its core provision is simple but powerful. It prohibits disability-based discrimination in organ transplant eligibility, thereby ensuring that patients are evaluated on medical criteria and not just disability status. Discrimination in healthcare is not new. Despite the protections of the Americans with Disabilities Act, gaps still remain. The ADA does not specifically enforce non-discrimination in organ transplantation. This bill seeks to close that gap. The issue affects nearly 61 million Americans that live with disabilities. This represents nearly 1 in 4 adults in the United States, so this issue is very significant and does need to be addressed. Let's dive into understanding the scope of the problem by looking at some research. A National Council on Disability report found that 1 in 3 transplant centers admitted to considering disability as a factor in denying a transplant. The JAMA Surgery Journal found that 57 to 89% of surgeons consider having a disability a contraindication for transplant surgery. That same study also found that adults with disabilities were 62% less likely to receive a kidney transplant than adults without disabilities. Furthermore, adults with disabilities were 54% less likely to even be evaluated for a transplant. The Journal of Pediatrics also published a study that showed that children with diagnosed intellectual disabilities only accounted for 7 to 9% of transplant recipients. Results showed that there were comparable long-term outcomes for all pediatric patients regardless of disability. So if the outcome is similar, why aren't patients with disabilities getting the transplants that they need? Well, Transplant International published a study that considered the ethical and legal issues of this topic. They interviewed experts from the medical and legal field and found that the reason was because of a preconceived misconception that the patients cannot handle the care needed post-transplant. They did not consider what support those patients had at home. They didn't consider family support, they didn't consider resources or anything like that. They only considered the fact that the patient had the disability and therefore could not take care of themselves. This outcome and results are similar to the studies published in Surgery and in Pediatric Transplant Journal, which showed the same outcomes, that these were just misconceptions and that patients did in fact have similar outcomes regardless of disability. This is a very important finding that many different journals support that shows that these patients are being discriminated against and something does need to be done to fix this issue. Next, we will discuss the social, economic, political, and ethical impacts of this bill. From the social perspective, according to the National Down Syndrome Society, there have been several instances when a patient with Down syndrome was unable to get a transplant and passed away. The bill supports equal access to life-saving organ transplants for people with disabilities. Additionally, the bill raises awareness about disability rights and starts a conversation about how this population is perceived. Economically, the bill grants fair access to transplants, which could reduce healthcare costs for families. By treating the patient with an organ transplant, spending would decrease as these programs would not have to continue to support their care. Additionally, the bill may cost facilities as they would now be required to provide accommodations, change policies, and train staff. From a political perspective, the bill was introduced to fill gaps in existing laws. The Americans with Disabilities Act, for example, does not explicitly discuss transplant decisions. The Charlotte-Woodward Organ Transplant Discrimination Prevention Act will provide specific protections that are missing from current laws. The bill is also supported by both parties. Republicans and Democrats are sponsoring and supporting the passage of this bill. Bipartisan support shows how important this issue is in society currently. The bill could set a precedent for future laws regarding other areas of medical discrimination as well. Finally, let's talk about the ethical impact. The bill addresses the ethical principles and fairness and equality. The bill prevents discrimination and demands that all patients must be treated as individuals with equal value. It diminishes the idea that someone is worth less than someone else just because of a disability and should have lesser of a healthcare experience. There is overwhelming support for this bill to pass. Supporters include disability rights advocates such as the ARC and the National Down Syndrome Society, medical ethicists and healthcare professionals, especially nurses, and then additionally it is a bipartisan bill with a long list of co-sponsors from both sides of the aisle, so there is a lot of political support here as well. On the other side, it was hard to find any research that truly opposed this bill, but the little bits of potentially problematic parts of this bill that I found in articles suggest that transplant centers may have concerns or oppositions because they will now have to spend the money to write new policies, create training for staffs, and provide resources for these patients. The ANA Code of Ethics directs nurses to advocate for human dignity and fairness in healthcare. Denying transplants based on disability undermines both ethical practice and civil rights. Provisions 1, 3, and 8 of the code perfectly align with the goals set in this bill. Personally, I believe passing this bill is not just legal necessity, but also a moral obligation. It ensures every patient has a fair chance at life as they rightfully deserve. Additionally, I think that all patients should be assessed as individuals and not put into a category and recommended care based on stereotypes. Furthermore, as a Christian, Matthew 25:40 perfectly reflects the goals of this bill. It states, "Truly I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me." Jesus often cared for people who were sick or disabled, even when no one else would go near them. We see this a few times throughout the Bible. Denying someone care based on a disability goes against this calling of us to serve and care for the vulnerable. This bill aligns with this value and promotes advocating for the vulnerable and caring for them. Therefore, this bill is in line with living a Christian worldview. This bill should be passed in its current form as soon as possible. However, there are some recommendations for future consideration. First, there needs to be increased transplant evaluation transparency. Patients should be evaluated on a case-by-case basis, and providers should have a clear understanding of what an aftercare plan would look like with them, if any resources need to be provided, and basically should provide any education to ensure that they will be successful after their transplant. Additionally, there should be required documentation if a patient is being excluded from the transplant list. This allows patients to feel that there is a medical reason for their rejection. It also protects doctors, as there will be a clearly documented reason that is medical for the rejection of the patient, and so it shows that they're not being discriminated against. And then additionally, it will show if there is a recurring trend of doctors discriminating or rejecting patients with disabilities, and then that can be followed up on. There also needs to be an appeals process if a patient feels that they are wrongly being rejected from having a transplant. Providers should also be educated on how to talk to these patients, how to assess them to make sure that they are ready for a transplant, and how having a disability is not a contraindication. These providers should be presented with the evidence we discussed today that discusses how these misconceptions of patients with disabilities having worse outcomes is not the case. They have the same outcomes and they should be evaluated fairly and justly. Furthermore, combining quantitative evidence such as the mortality disparities with qualitative evidence such as these expert testimonies make this case undeniable, and there should be no reason that this case is not passed. In conclusion, this bill fills a critical gap in our healthcare system. Passing the Charlotte Woodward Act would uphold civil rights, promote equity, and ultimately save lives. Policymakers have the opportunity to ensure that organ transplantation decisions are made on the basis of medical need, not prejudice. Therefore, I urge you to support this legislation and call on you to support and advocate for the passage of this bill. Thank you. Thank you very much. And here you will see all of the references and studies used in preparing this presentation.